Andrea Dalzell is the first registered nurse to get through nursing school in New York City in a wheelchair. She completed an undergraduate degree at the College of Staten Island, majoring in neuroscience, biology, and nursing, and is currently getting her master's in nursing education. She's an advocate and activist for the rights of people with disabilities. She was awarded SUNY's Emerging Leader of the Year Award and also received the Cindy Lou Disability Rights Advocate Award of 2015. During the recent pandemic in NYC, Andrea was called to the front lines of COVID to help save the lives of people in need. She's a personal hero of mine who never surprises me but always impresses me. Earlier this week, Andrea and I were able to sit down for a conversation about her experience and inspirational work. Let's take a look. Hi, Andrea. Welcome to Disability Night platform. Thank you so much for coming today. We're very honored to have you. You're known as the seated nurse. Could you give us a little bit of backstory about yourself and about your disability?
So about me, yes, I'm the seated nurse. I'm the first registered nurse here in New York City to graduate out of nursing school and be a wheelchair user at the same time. And my little backstory is that I also have transverse myelitis. I was diagnosed at the age of 5 and completely stopped walking when I was 12 years old.
Wow. You're a very gifted, talented person. I've known you for a long time. You've also been Miss Wheelchair New York. What made you want to become a nurse?
You know, I actually didn't always want to be a nurse. I think a long time ago, we had spoken about representation and what that meant to us, right? And I didn't see people that look like nurses, that look like me as a nurse, not as a woman, not as a woman of color, but, you know, as a woman that had a disability. We don't see ourselves in nursing. So it wasn't something that I had always thought of. I wanted to be a doctor. I actually wanted to be a lawyer before that. And in trying to get towards where I really wanted to be in life, I really thought about giving back and being of service to someone else. And kind of nursing is where that fit in for me, especially within doing audits for medical school. You know, medical school teaches you that you're treating a disease process. You're treating how a disease process works throughout someone's body. I didn't want to treat someone like they were a disease process. I wanted to treat them as a person. So nursing fit right in there.
So do you think then, as a nurse that's in a chair, do you think that there was any perks or beneficial aspects of being able to be relatable to people when you meet them in the patient setting?
Oh, 100%. Being in the seated position or any disability at all, you are bringing a perspective that somebody might not have, right? We know that disability is often deemed the death sentence, quote unquote, right? We don't see life past a disability, but when you come into nursing and you have your disability already and now you're at the bedside, that person knows that life goes on outside of the four walls of a hospital or outside the four walls of a clinic. You're giving them that new lease on life, a hope that probably doesn't come from a doctor or a nurse that doesn't have a disability. You know, it's definitely a different perspective, and we're innovators. So of course there's a perk there. We already know how to think 20 steps ahead.
Exactly. You recently were on the front lines of the COVID-19 crisis. Could you tell us a little bit about that and your experiences?
Yeah, COVID in New York, you guys all know, hit like a tornado came through. The amount of lives lost, the amount of those who are sick, the amount of those who are recovering is something that's going to be an endless journey from here on out. It's the new normal, they say, right? This is not a normal that I want. We don't want to be on lockdown. You know, we don't want to have our loved ones being sick or, you know, having to go through what COVID is doing to our bodies. You know, luckily, and I say this within a hope sense, right? So luckily, as those of us with disabilities already understand the scope of being excluded, possibly not leaving our homes, being afraid for, you know, going in and out of hospitals or clinics, we understand this life a little bit more, right? We can kind of adapt to it a little bit more than the general public. And, you know, we get to now step up and say, we know what this is like. Share your stories, help everyone else get through it, because we still have to get through this together.
Exactly, exactly. What advice would you give to our community in general during this pandemic? Because I know a lot of people have been isolated, which is maybe not normal from our normal routines, or separate from our normal routines. But what advice would you give to them to maintain a healthy lifestyle?
Try to avoid being out in big crowds right now. If you do have to be out, wear a mask, make sure you're washing your hands. Don't miss appointments. Okay, guys? I know a lot of us are staying away from clinics and hospitals, but you are only jeopardizing your health when you do that. Make sure that you are still getting out there to your physicians and making sure that you're getting the treatments that you need. Do not put those off. We want to make sure that we're keeping healthy, and in order to do that, we need to follow up with our physicians. And I'm telling you, as a nurse that has been in all of these buildings and has been at the bedside at the peak of COVID, they are putting in every precaution to make sure that we are staying healthy when we do enter into those settings. So please make sure that you're taking care of yourselves. Get outside, get some sun, call a friend, and don't think that you're alone through all of this. You're not.
Mm. Yes, definitely, definitely. What advice would you give to somebody younger than you who wants to be a nurse or work in the healthcare industry? I imagine it wasn't an easy road for you to be understood and accepted into that community.
It definitely was an uphill battle. I will not deny you there. This is still a profession that needs to understand that disability does not equal inability, right? Just because I'm in a seated position does not mean that I cannot be of service to you in any which way or form. I think even within our own community, we try to put the same biases, this ableistic bias on ourselves, like, oh, we can't do something because that's for someone who walks, or how would you be able to lift? All these questions about how can you do something. The thing is, we do things differently. As someone with all different abilities, whether you have a hearing impairment, whether you have a vision impairment, whether you're standing or using crutches, whether you can't lift or you must sit, we have different ways of being innovative and how we come up to a solution, right? Sometimes you need to ask for an extra hand, and sometimes you actually can do it by yourself. So we have to remember that everyone's perception of us does not define us, right? So
Exactly.
therefore, you get to choose how you wish to enter into this field and decide, what your story is going to be. No one else gets to decide that.
It's beautiful. Where do you see Andrea in 10 years from now?
Ooh, Andrea has just started her master's degree in nursing. So right now I am studying master's in nursing education with the hopes of possibly becoming a doctorate of nursing practice within the next couple of years. We shall see. I would love to be able to give back to our community. It's really, really imperative that we have people in healthcare that understand our plight. They understand the disability role. They understand the disability from the side of having a disability and being able to then now treat it. Not just treat and not understand, but to treat and understand changes everything.
That's beautiful. Andrea Dalzell, thank you so much for being with us today here at Disability Unite. You are a visionary in your words. You're an educator, and you are an inspiration to so many people. You're a milestone in the community that is helping to push our community forward. So I personally thank you. I know the community thanks you. And I'm inspired by you every day. So thank you for being with us today. And we wish you the best of luck. And we'll definitely be following you.
Thank you so much, Corey. Thank you, everyone.
Take care.
Bye.